So let's reveal the option set. And it is as follows. A, axonal loss in the most distal portion of the nerve. B, concentric proliferation of Schwann cells. C, deposition of antibodies on myelin sheaths. D, disorganized aggregates of collagen and mini fascicles of axons. E, perivascular lymphocytic infiltrates. Please put your answer in the poll now. Okay, and it looks like most of you went for A, axonal loss in the most distal portion of the nerve, and we had a few takers for C, deposition of antibodies on myelin sheaths. Let's go ahead and reveal the keyed correct answer. And the keyed correct answer is A, axonal loss in the most distal portion of the nerve.
When I saw the Schwann cell, I was like, okay, there is something wrong with Schwann cell and myelination. So that might be the correct answer. But then I saw antibodies and I was like, okay, this is pointing me toward the immune problem, not actually the problem that this patient is dealing with. So I just scratched that answer and then I went with A.
All of these choices should point at some kind of disease state and that they shouldn't be entirely made up. They have to all be plausible choices, not necessarily pertaining to the patient in the scenario, but they should all be some physiologic mechanism behind a certain disease state and not entirely made up, which is one of the basic principles on how we craft these questions.
The myelin sheath antibodies would more likely suggest that there is multiple sclerosis, and you would have thought about central nervous system defects and the fact that your proprioception or your dorsal columns and your are not affected would kind of push you away from a central nervous system issue and make you think that it's a peripheral nervous system issue.
For deposition of antibodies of myelin sheaths, to me sounds like a type 3 hypersensitivity reaction, where MS I've learned previously was type 4. Is there a part to it that I'm missing on that as to if that were talking about MS?
I'll try to answer this one as an item writer, which is that something on that level of detail might be important, let's say, for your neurology boards. For the generalist, thinking about writing a question that is going to aid the highest number of medical students and help them to arrive at the concepts that we would like them to know, choice C is about all that a clinician would want to convey about multiple sclerosis being part of the differential diagnosis here. There are certainly scientists and immunologists and all sorts of backgrounds and experiences, but fundamentally we want you to know the concept without necessarily getting too deep into the weeds, so to speak.
Stephen, what I wanted to add, and again, going back to your question, you're exhibiting exactly what we would expect students to do with the questions and say a self-assessment. Or if you saw this question, again, think about all the different types of questions that Dr. Nori and her colleagues could write about this presentation, and then really sort of massaging each of the options and saying, just like you did regarding the meaning of what deposition of antibodies on myelin sheaths means, and then creating, literally think of a whiteboard where you're writing that down and making a big diagram of all the things that you should be thinking about and going back and reading about that connect to this case. I think that's a really, really good point for people to hear about.